Lobotomy, micron mutated tome cut, slice, is a neurosurgical procedure, a form of psychosurgery, also known as a leukotomy or leucotomy. It consists of cutting or scraping away most of the connections to and from the prefrontal cortex, the anterior part of the frontal lobes of the brain. The procedure, controversial from its inception, was a mainstream procedure in some Western countries for more than 2 decades despite general recognition of frequent and serious side effects. While some patients experienced symptomatic improvement with the operation, this was achieved at the cost of creating other impairments, and this balance between benefits and risks contributed to the controversial nature of the procedure. The originator of the procedure, Portuguese neurologist Antonio Gasmondas, shared the Nobel Prize for Physiology and Medicine of 1949 for the discovery of the therapeutic value of leucotomy in certain psychoses. Although the awarding of the prize has been subject to controversy, the use of the procedure increased dramatically from the early 1940s and into the 1950s. By 1951, almost 20,000 lobotomies had been performed in the United States alone. Following the introduction of antipsychotic medications in the mid-1950s and under the influence of the anti-psychiatry movement, lobotomies were quickly and almost completely abandoned. Effects. The purpose of the operation was to reduce the symptoms of mental disorder, and it was recognized that this was accomplished at the expense of a person's personality and intellect. British psychiatrist Maurice Partridge, who conducted a follow-up study of 300 patients, said that the treatment achieved its effects by reducing the complexity of psychic life. Following the operation, spontaneity, responsiveness, self-awareness and self-control were reduced, activity was replaced by inertia, and people were left emotionally blunted and restricted in their intellectual range. The consequences of the operation have been described as mixed. Some patients died as a result of the operation and others late committed suicide. Some were left severely brain damaged, others were able to leave the hospital or became more manageable within the hospital. A few people managed to return to responsible work, while at the other extreme, people were left with severe and disabling impairments. Most people fell into an intermediate group, left with some improvement of the symptoms but also with emotional and intellectual deficits to which they made a better or worse adjustment. On average, there was a mortality rate of approximately 5% during the 1940s. The lobotomy procedure could have severe negative effects on a patient's personality and ability to function independently. Lobotomy patients often show a marked reduction in initiative and inhibition. They may also exhibit difficulty putting themselves in the position of others because of decreased cognition and detachment from society. Immediately following surgery, patients were often stuporous, confused, and incontinent. Some developed an enormous appetite and gained considerable weight. Seizures were another common complication of surgery. Emphasis was put on the training of patients in the weeks and months following surgery. Freeman coined the term surgically induced childhood and used it constantly to refer the results of lobotomy. The operation left people with an infantile personality. A period of maturation would then, according to Freeman, lead to recovery. In an unpublished memoir, he described how the personality of the patient was changed in some way in the hope of rendering him more amenable to the social pressures under which he is supposed to exist. Quote, he described one 29-year-old woman as being, following lobotomy, a smiling, lazy and satisfactory patient with the personality of an oyster who couldn't remember Freeman's name and endlessly poured coffee from an empty pot. When her parents had difficulty dealing with her behavior, Freeman advised a system of rewards and punishment. Russian psychiatrist Fedor Kondratyev of the Serbsky Center said that thousands of the people with schizophrenia to whom the method was applied had completely lost the remnants of the mental health